The Pharmacy Council of India recently implemented the Education Regulations 2020. For first-year diploma students, this document introduces a strict new grading rule. Exactly 20 marks of your final theory exam are now locked into mandatory objective-type questions. This visual shows exactly why those 20 marks matter. The math dictates that securing a perfect score in this single section provides enough mathematical leverage to push a failing 20 out of 80 grade straight across the passing threshold. You will face this exact objective question format across all 5 of your Part 1 subjects: pharmaceutics, pharmaceutical chemistry, pharmacognosy, human anatomy and physiology, and social pharmacy. Securing these points is the most mathematically efficient strategy to guarantee your survival through the new first-year curriculum. Let's look at exactly how to tackle them. Here is a standard pharmaceutics question you will likely see. It asks you to identify the specific equipment used for the unit operation of mixing. The answer is C, the double cone blender. The syllabus strictly categorizes the others differently. The hammer mill is for size reduction, the cyclone separator is for size separation, and the fluidized bed dryer is used for drying. Let's test pharmaceutical chemistry. This question asks you to select the exact group of impurities mandated for limit testing under the official pharmacopoeial guidelines. The correct group is A: chlorides, sulfates, iron, heavy metals, and arsenic. General knowledge will not earn you these marks. You have to memorize the exact operational categories and the standardized chemical lists dictated by the syllabus text. Let's run an active recall test for pharmacognosy. Which of the following is not an official classification method for crude drugs? Take a guess. The odd one out is geographical. The ER 2020 syllabus strictly limits the classifications to alphabetical, taxonomical, morphological, pharmacological, chemical, and chemotaxonomical. Moving to human anatomy and physiology, what is the precise biological term for the formation of blood cells? The correct term is hemopoiesis. Finally, social pharmacy. Which of these diseases is officially categorized as an intestinal infection? The answer is cholera. The syllabus specifically groups diphtheria, tuberculosis, and Ebola together as respiratory infections. For the life science and social subjects, the exam evaluates your ability to rigidly categorize diseases and physiological processes exactly according to the regulatory definitions. Here is one last question regarding the exam board structural rules. Out of the objective type questions provided in the final board exam, how many are you required to answer? You must answer all 20. The long and short answer sections give you choices, allowing you to skip a few questions. The objective section offers 0 options. It is entirely mandatory. This cheat sheet maps out the exact structure for your 3-hour final exam across all 5 subjects: 6 long answers, 10 short answers, and the 20 mandatory objective answers. Feel free to save this breakdown. Passing the ER 2020 curriculum requires a strong grasp of the medical science, but you also need a calculated, tactical approach to navigate the mandatory constraints built into the test itself.